Well, good evening, and thanks for joining me here today. Normally, when we'd be in a time of crisis, we'd be meeting together and talking together, but that's not going to be possible now. And so I appreciate TV and internet giving me this opportunity. And I want to talk to our employees and the public about what we are doing right now. And we've not seen anything like this. You know that. It was just a month and a day ago. Detroit had its first case, March 13th. Seems like a year ago, doesn't it? But that day, I was instantly transported 8 years ago when I used to run a hospital system. And I knew what was coming. That for most of us in our lives, there's no deeper fear than an illness that might hit us or might affect a loved one. If you've ever sat by the bedside of somebody that you care about, you don't know if they're going to make it or not, that anxiety, that helplessness that you feel, you remember months and years later. And good hospitals and good doctors deliver quality care. What great hospitals, great doctors know is that the care isn't enough, that you have to let that patient and their families know they're not in it alone, that there's somebody there that helped them, to care about them and is going to see them through. And I knew when this started the fear that the pandemic would bring. And I really thought we could be a city that could say to our residents, you're not in it alone. And so in that month, it's been tough. But we had to respond quickly. When the Detroit public schools were canceled, for a lot of parents, it was an issue because you had to be home and take care of your kid. But for a lot of these children, the only nutritious meals they were getting were at school. And all of a sudden, the basic nutrition was in jeopardy. We instantly stepped in, and we knew DPS couldn't do all of this, and set up almost overnight 6 recreation centers where we're delivering 40,000 meals a week where the parents can pull up the food in their trunk. We wanted those parents and children to know they weren't in it alone. And our homeless in our community who can't get health care in the best of times, we're going to be very much at risk. And we wanted to reach out to them right from the beginning. And so Arthur Jemison and Donald Rencher and our housing team immediately sent nurses out twice a week to every one of the 30 warming centers and homeless shelters, checking on every single homeless person. And in partnership with the Detroit Rescue Mission and with Salvation Army, we set up centers that if they ran high fevers, we separated them. If they were coronavirus, COVID-19 positive, we had a location where they could be cared for, because we wanted to make sure these folks knew we weren't so busy that we had forgotten. No, they weren't in it alone. And when our small businesses were in trouble, they've been the lifeblood of this city's comeback. And all of a sudden, their cash dried up. We brought in a whole group of funders to start up grant programs and programs to purchase meals from restaurants, loan programs and the like, because we want our small businesses to know they're not in it alone either, because when we come out of this, we're going to be right back in their stores, and we want them waiting and open for us. And so we tried to set this tone that says in the city of Detroit, you're not in it alone. And we've needed it, because so far we've lost 424 of our neighbors, and we felt every single one of them. And the men and women who work for the city of Detroit, who have had so much to do with bringing the city back in the last 6 or 7 years, we've lost 8 of our own employees, 3 from the police department, 3 from the building safety and inspections department, 1 from the fire department, and a bus driver whose story we all know. And to the families of all of those great public servants, everybody in the city feels your loss. And more recently, we've started to realize that many of our most vulnerable residents, those in the nursing homes, are at risk. And now we're stepping in to make sure they know they're not alone. So at first, we got hit as hard, as fast as any city in the country. And it came so fast, our residents started to get the fever, started coughing, shortness of breath. We found out the average Detroiter couldn't get tested, which was hard to believe for me at first. And then, of course, the national media started. Poor Detroit. This is NBC. Detroit's reeling, as if this virus was going to put the city under after all we did. And I tried not to get too reactive to it, but this was kind of like the same old stuff, except I knew how the city was going to respond. But here's the thing that made me so angry. There were only 125 lab tests being done a day in the entire state of Michigan. I'd turn on the TV, and I'd see a professional athlete or a celebrity talking about how they just got tested for COVID-19. And I got a mom with 3 kids off of Finkel who's running a fever and coughing, and she can't get near a lab. I said, this is not right. And so we're going to do something about it. And when I got angry at my former colleagues in the hospital business, where is the lab capacity? They said, you don't understand. There is no lab capacity in Michigan. So where's the lab capacity? He said, it's in New Jersey, and there's nothing we can do. I said, well, BioReference in New Jersey called our friends, Jamie Dimon and JP Morgan Chase, and said, you've been with us all the way. Do you know anybody at BioReference Labs? And they said, yeah, we're their banker. I said, well, I need some help. People in Detroit need lab tests. And Boise Jackson and our great procurement team, within 24 hours, had a contract, and now we had a place to do labs. They said, well, that won't do you any good. You don't have any medical staff. Who's going to do the samples? And we went to Henry Ford and DMC and Trinity, the St. Joe's and St. Mary's system. And I said, I know you guys are swamped beyond belief, but there's nothing more important than making sure everybody has access to testing. And to their enormous credit, these 3 hospital systems for the last month have had staff out there every single day at the fairground site to make sure that you get tested, and I hope it's something we don't ever forget. And so then said, well, that's okay, but you don't have any test kits. I said, now that cannot be possible. And it turns out, getting swabs and test kits, I said, how could you run out of them? Of course, the answer is because in America we rely on swabs made in China. And all of a sudden, we don't have test kits. And they said this is going to be an unsolvable problem. But again, Detroit's never in it alone. And I called Dr. Roberto Romero at the NIH, who runs the perinatal research branch right here in the city of Detroit for the federal government. They basically do all kinds of testing to help prevent premature birth and infant mortality. And I said, I doubt that anybody's called you about infectious disease, but you guys are experts in lab tests. You think you could make me up a group of swabs with medium? And he said, give me the specifications. And Dr. Romero and NIH and the Wayne State people worked through weekends and made us up 12,000 test kits. And now we're set. And so we started. And then people said, well, an average Detroiter, I don't have a doctor. I don't have insurance. I can't get the lab test because the state law says I need a prescription. And so Denise Fair and our health department and reached out. I made a number of phone calls myself to doctors, and 30 doctors' offices in this city within 24 hours said, we'll take new patients, we'll take them whether they're insured or uninsured, and 30 doctors' offices started taking in patients and writing prescriptions. And then I heard from some folks who said, I got my prescription, I'm sick, but you have a drive-thru place and I don't have a car. I'm here alone. I said, you know what, in Detroit, you're not alone. And when I went to Gary Torgo, the president of TCF Bank, and said I got folks in their homes and they can't get out, he wrote a $100,000 check and said, we're going to make sure everybody in this city who needs a ride is going to get tested so every single Detroiter can do this. And then Governor Whitmer, Dr. Khaldun, who were enormous in sorting out the bureaucracy for us. This is the way it is. The one place in Michigan where everybody can get tested is Detroit. And we've now been operating one of the most successful drive-through test sites in America. And today, we did our 8,000th drive-through test. And it has been a great accomplishment in our community. So then, you think that problem solved. All of a sudden, we have coronavirus sweeping through the police department. 600 officers quarantined. The only way, if you've been exposed, you were being sent home for 14 days. If you can go to the drive-through test, we'll get your result in 4 or 5 days, which for most people is okay. But if you need to get cops back to work, we need something else. But on a Friday, the FDA approved a 15-minute test for Abbott Labs. By Sunday, we had a signed contract to be the first city in America. They delivered them here that week because I talked to the CEO and I said, I've got 600 cops, I got 200 firefighters, I got 100 bus drivers who can't go to work because they don't know if they're positive or negative. They don't know at night with their families whether they need to be staying in the garage. And he said, we're going to get to you first. And so we've now done 2,000 instant tests in the first 2 weeks. Detroit, we're not in this alone. People have backed us all the way. We've been able to return nearly 1,000 police officers and firefighters and EMTs and bus drivers back to work because they got a test that said they were negative. We also found nearly 200 who tested positive, and we were able to get them right to the correct medical care. This is the way that we respond as a city. And instead of being a victim, we said, we're going to step up for the region because that's what a great city should do. And so when the Wayne County Sheriff's Department had difficulties in the jail and needed their deputies tested, we stepped up and did the 15-minute test for them. When the state corrections officers needed testing for people working in the prisons, we stepped up and did the testing for them. We are now into the nursing homes now. We don't license and certify nursing homes, but we are into every single one of them right now testing those residents because that's what we should be doing. And at that fairgrounds, we've tested 4,000 of our neighbors in Wayne, Oakland, and Macomb counties because we are one region. We didn't ask for any contribution. We just said this is what we should be doing. And if you ever think for a second we're alone, look at the 100 partners who have funded us on all of these projects. It has been heartwarming to see the way the people have rallied to this community. But nothing has meant more than the way the people of Detroit have responded when we reached out and asked for support on social distancing. 2 weeks ago, as the coronavirus was spiking in this town and Chief Craig was off on quarantine and Assistant Chief James White came in, and we were ready 2 weekends ago to close the parks. We had the plans ready, we had the barricades ready, and we asked for the people of this city to step up and to talk to your neighbors, to talk to your family members. And that weekend, I was all over the city. It was amazing. People were spaced out. They were walking ones and twos at a time in our parks. The police had some issues, but people were of goodwill and broke up relatively quickly. And we took down basketball rims in about 40 parks, but in 3/4 of our parks, we didn't have to take down any rims. There were neighbors who were strong enough presence in their neighborhood, they told the kids to knock it off. We never needed the police to go in and do anything because of the community buy-in. It is remarkable the way this city has responded, and I think we've taken the charge seriously. At this point, everybody knows that if an African American gets the coronavirus, they are 2 to 3 times more likely to die from it than a Caucasian. This is true in New Orleans, it's true in Chicago, it's true in New York. The urgency that we have to watch out for each other in this community is clearly being felt. And I said at the beginning, our report card would be the TCF Center where they built the hospital. And it opened last Friday. 1,000 beds, they thought there would be 250 patients this week. They've been open 5 days now, and today they have 8. We are starting to bend the curve. There are 8 patients there, not because of me, because the residents of this city who decided that they cared for each other. And all over this town, I see people walking in mass, I see people spacing out. We're starting to make progress. But I don't want anybody for 1 second to think this is over, or that you can go out this weekend and go back to big groups in the parks. It isn't over yet. And places in this world who thought it was have paid for it with their neighbors' lives. If you look at what's happened around the world, in Japan, they declared victory, and now they've got a huge spike in COVID-19. In Hong Kong, where they got international stories about how they knocked this virus down, and they got complacent, and now it's back up again. We have to finish the job. We don't want to go through this twice. But if we stick with this for a few more weeks, I think we can change the direction. Unfortunately, we don't get to just solve one problem at a time, because while we have a health crisis, we have the biggest budget crisis this city's seen in 7 years, and we have to solve it at the same time, and we're going to try to solve it without drama. We're going to try to solve it professionally. And so here's our budget process. Our fiscal year runs from July 1st to June 30th, so we got about 2.5 months to go in this year. We're in the fourth quarter. The new fiscal year, which starts July 1st, council has to adopt the budget next month. So right now we got to deal with 2 budgets at once, the end of this year and the start of next year. The State Financial Review Commission that was put in place out of bankruptcy still exists. It used to actively watch everything we did, but we got a provision in the law that if we balanced our budget and managed everything well for 3 years, we got out from their oversight. And we were able to do that. But if the review commission's in place, they run the city of Detroit's life. They approve our budgets, our contracts, some of our key appointments, our policies, etc. We got out in April of 2018 because my partners on Detroit City Council were extraordinarily responsible. None of us wanted to ever lose self-determination again. And so the review commission doesn't have active oversight unless we run a deficit. And if we run a deficit, the review commission pops back to life and stays for a minimum of 3 years again. If we do not handle this deficit ourselves, the state of Michigan is going to be running this city again. And I am going to do everything I can to make sure that does not happen. So let me talk to you a little bit. And I know I get nerdy on this stuff, but for the 8,000 employees who are watching, this is going to matter to you because it's going to affect each one of your lives. Our budget is about $1 billion. We got about 8,000 full-time employees. And 30% of our money comes from income taxes. The income tax you pay on your paycheck, the income tax the corporations in this town pay. About 19% comes from revenue sharing, a check from the state of Michigan. About 17% comes from the casinos, which, as you know, are not open right now. Property taxes are only 10%. We probably rely less on property tax than any city in the country. And then the rest are parking fees and court fees and a number of other revenues. That's what makes up our budget. So what's happening? Well, we were doing extremely well. But now with the income tax, as people are being laid off, businesses are cutting back, we're losing 13%. And even the unemployment benefits, it's interesting, when you get unemployment benefits, you pay state income tax on it, but you don't pay city income tax. The state wrote that law. And so we get even a double whammy there, but we're looking to drop 13% on the income tax. Our revenue sharing, the sales tax in the state is going to drop, so we're probably going to drop 11% there, not because the state did anything to us, it's the natural formula. The casinos have given us 0 since March 17th, and we don't know when they're going to reopen. Property taxes will probably drop next year when property assessments go down. Unlike what happened in 2009 and 2010, we are going to assess properly, and if property values drop, we're going to fix the assessments immediately and drop them. So we're expecting a drop in property taxes. And we're losing revenues from everything from the parking meters to people paying fines in court, all of those things that are shut down. And so when you look at that, you say, next to Las Vegas, which is getting hit harder than us, we probably got hit harder than any city in the country because we rely on the casino taxes so heavily. Usually, even in a recession, people play casinos and the casino taxes are a solid source of money. This is an oddity that it's a financial downturn where the casino revenues were lost first. That has not been projected in any model we've ever had. So how much does it add up to? This year, which ends June 30th, we're going to lose $154 million. You can see between the income taxes, the casino taxes, the parking fees, and the like. And then next year, the Budget Council is about to adopt, because we know revenues will be down again. Casinos, they are not going to open all the way up July 1st. I don't think that's realistic. We're going to lose another $194 million. We have to solve for a $348 million budget shortfall now if we do not want the state back deciding our finances. Now, what I'm going to talk about today in the orders I'm going to enter apply to about 8,000 employees under the executive branch. So for our employees who are watching today, I want to be clear on who it applies to and who it does not. What I'm talking about today doesn't apply to the land bank, the water sewer department, the public libraries, which are actually run by the school board. A lot of people don't know that, and the public lighting authority. Those have separate boards. So what I am saying today does not apply to them. I hope they'll follow my lead, but what I'm saying today does not apply to them. I also cannot tell the legislative branch and the independent agencies what to do, although I know City Council is already working on this, but I hope that the independent agencies will follow suit. But what I'm going to be issuing in an order doesn't apply to them either, because I don't have the authority to tell them what decisions to make. It does apply to everybody else in city government. So, how do we eliminate $348 million in 16 months? It sounds pretty scary, doesn't it? And in past years in Detroit, it would have been scary, because city government is about people delivering services. Every time there is a downturn, it's the city employees that bear the brunt of this, because basically what we spend money on is people. $650 million of our $1 billion budget is salaries and benefits to our workers. If all we did was take 65% of the deficit from the employees, because that's the share of the budget they are, every one of our employees would have to take a 20% pay cut, or we'd have to lay off more than 1,800 people. That's what would happen. And those who have been here in 2009 and 2010, 2012, you've been through those years when your pensions were cut, when your health care was cut, when your wages were cut, where your friends and coworkers were being laid off. We expected a downturn, and we prepared for it. I can't tell you I expected it to be this sudden and this dire, but we are far more prepared than this city was before. And I'll show you why. During the bankruptcy, the court approved a plan of adjustment. And that plan, this chart was a central exhibit in the plan. It said that we would sign up for a plan that said our income tax revenues would grow 2% every year. If you looked over the last 10 years, that seemed ridiculous, because they had basically dropped. But it was the last thing I agreed to when we got the plan approved. And so all of our plans come out of bankruptcy assumed our income tax would go up 2% a year. Here's what's happened. The businesses and people coming back have exploded. All of these major companies you've seen come to town, all of the expansions that have been done. You hear this stuff about, we gave a tax giveaway on a property tax thing. And I get so frustrated with it, because we give somebody a relatively small property tax break because they're paying a huge amount in corporate income tax and personal income tax. And because we brought those companies in, instead of attacking companies and driving them out, we welcome them in. We've been running way ahead of budget last year by $80 million, ahead of what bankruptcy thought. This year we'd have been $100 million over if it hadn't been for the coronavirus. That's how much we've been succeeding. Here's the interesting thing. In the past, when the city got a little bit more money, they started spending it on more services and the like. Council President Brenda Jones and our budget chair, Janae Ayers, have been absolutely phenomenal in saying, before we start spending more money, we're going to put money away in the rainy day fund. We're going to put money in the retiree protection fund, so those pensioners never again have to see their pension cuts. It's not an easy thing when people show up at council saying, I want money for this and I want money for that, and you have to say, no, we have to save it for another day. That's a hard thing to do politically. But we had enormous leadership. The only areas where we expanded service with this new money was expanding the police department and doing the blight removal. An awful lot of the demolitions, the board ups, the cleanups that you've seen were funded from this. But other than that, we were saving this money for a day that we thought might be coming. And so when I look at how we eliminate this $348 million shortfall, these are my principles. Council may or may not disagree when they look at them. One, I think we maximize the use of the rainy day fund and other savings. If it isn't raining now, I don't know when it is. I believe we're absolutely justified in using the rainy day fund in our savings before we start laying people off. Second, we can't cut police, fire, EMS, and bus service. This city has been plagued by days when the police didn't show up for a half hour, the ambulances didn't show up for an hour. We're not going back to those days. I want us to keep the police, the fire, the EMS, and our bus at their current levels. They should be the last thing that should be touched. Third, this is a hard thing to say, but we have to let the temporary and part-time workers go before we lose our full-time employees. And we are going to have to lay off some temporary and part-time workers. There's no way around it. Fourth, this virus is temporary. The economy was good before it hit. And so I don't want to just lay people off. I want to find a way to stay connected, because if we lay off our good people and they go get another job and then 4 months from now we want them back, we've lost their talent. And so I wanted to find a way to say, could we reduce their hours instead of laying them off? Fifth, probably the thing that I cared about the most. I want to make sure our employees and their families don't lose their health care. The federal government has made, by historic standards, a very generous unemployment benefit. And so folks in this country who are being laid off are getting more unemployment support than they ever have. The problem is they lose their health care. And if you lose your health care, getting it back can be very difficult. Can you imagine if we lay off our employees, they lose their health care, and a member of their family gets COVID-19 and is on a ventilator in a hospital, they don't have care? We're going to have employees who helped bring this city back from bankruptcy going to end up being bankrupted themselves. And so I want to make sure that not a single one of our full-time employees who has health care benefits now loses their benefits. I'm not sure we're going to be able to do it, but I'm going to try really hard to make sure none of our employees loses their health care. And then finally, if it's a choice between the blight funding and employees delivering services, we're going to do the services. If it means we've got to let the blight spread in the neighborhood to protect police, fire, buses, and other services, the services have to come first. That's my priority. Council may or may not agree with me on that, but those are the 6 principles that you're going to see that we used in putting this plan together. So, how do we do it? The interesting thing is this. We saved up enough money, and there's enough federal help, that we can cover 80% of this deficit without cutting employees' wages and benefits. We've got $101 million of surpluses we saved from the last 5 years, and $50 million we formally put in a rainy day fund. This is what we saved it for, and I'm proposing we use that $151 million to blunt the effect of this crisis. We have $72 million in blight funds planned for demolitions, board ups, neighborhood cleanups, and the like for the rest of this year and next year. And I am suggesting that absent a house that's about to fall over, we cancel the demolitions, we cancel the board ups, and we put the money into services and we keep our people working. Now, Council and I are going to have to deal with this issue, and we should have dealt with it last year, but if it's a choice between laying off hundreds of people or doing the blight program, I want to keep our people working and the services being delivered for Detroiters. We've got about $33 million in capital projects, many of them IT programs, some of them replacement vehicles. It's not a good thing to delay them, but given the crisis, we're going to have to do it. And our chief financial officer put in a cost-cutting order, cutting a whole range of costs. Those things together, and what Congress and the President just did in the CARES bill, was provide an additional $36 million in federal money for transit. Those things add up to $298 million because we have been planning for this for 5 or 6 years. We've got $298 of the $348 million crisis in a way that it's going to hurt, but we can handle it. There's no way around the fact that the last $50 million are going to have to come from the men and women delivering service in this community. And here's how I'm going to propose that we do it. First, I hate to do this, but we are going to have to lay off about 200 part-time, temporary, and seasonal employees. There's a part-time or temporary employees without benefits. Many of them are 20-hour-a-week recreation department employees, play leaders, lifeguards, the locker room attendants. Our rec centers are closed. We can't have kids congregating in a rec center right now because of the coronavirus. And so we can't afford to pay folks who aren't coming to work at the rec center anymore. And so we have some temporary administrative special services staff. The city HR department will be filing your unemployment claims for you this Saturday. But we are going to have to lay off 200 part-time and temporary employees. We still have $44 million more. And our 8,000 full-time employees are going to have to take the brunt of that $44 million. And here's how I'm proposing that we get through this in the hopes that we can hang together and ultimately come out of this as a single group. There is going to be a group of people who we're going to reduce to 10% of your hours. You're basically going to work 4 hours a week. And so you'll get a paycheck that was 1/10 the size of your paycheck. The reason for this is if we laid you off, you would lose your health care. But if we pay you 10%, we can legally keep paying your health care. And this is what we're going to do to make sure your family continues that health care. We're going to have a group of 80% workers. These are folks who will show up 4 days a week, take a furlough day 1 day out of 5. You'll work 80% of your hours, 4 days a week. You'll get 80% of your pay, and you'll get your health care. We're not going to be able to do pay increases for anybody in July. The third are the executives who are making over $125,000. I'm going to be in this group. We're going to work 100% of our hours. We're going to take a 5% pay cut. And there's not going to be a pay increase for us on July 1st either, but it is very important that everybody, no matter how hard you're working, shares in this. We've got to do it if we're going to be able to afford the health care for the workers in the first couple of categories. And the fourth group are the 100% workers, people who are going to keep all their hours, keep all their pay, but we aren't going to be able to afford to do a pay increase July 1st. All 8,000 of our employees fall into one of those four groups. Let me tell you about them right now. This is the way it's basically going to break out. About 900 employees will go down to 10% of their hours. 1,300 will go down to 80%. 100 employees will get 95%, and about 5,500 employees will keep their pay but will skip the pay raise. That together gets us $44 million. Now, if the economy opens up faster and comes back faster, we'll ease that off. If it comes back slower, we're going to have to come back and talk about laying people off instead of just going 10%. But this, I believe, is a reasonable expectation. So let me tell you about the different groups. Here's the Category A workers. A lot of them, they're the DPD traffic control officers, the guys you see out in the street in the yellow vests. And we don't need traffic control officers right now. There's no traffic jams, right? The DDOT ticket sales tellers. We aren't selling DDOT tickets because the fare boxes are closed. We've delayed all the road repairs, so we don't need the DPW drivers. At the B-Seat offices, nobody's taking building permits. These folks, if you are today at home and not really working, you are probably in this 10% class. We don't have work for you today. We'll pay you 10% and keep your health care. But when DDOT opens its fare boxes again, we want to bring you back. When the traffic starts to clog up on Jefferson, we want to bring the traffic control officers back. Here's what's going to happen. You're going to draw 10% of your city pay every other Friday. You're going to get the same kind of city paycheck that you have. It's going to be 1/10 the amount. You're going to keep your city health insurance. Won't change for you or your family. You're going to get state underemployment insurance for the 90% of the time you were cut. And there's a formula that works that out. But you can draw your city pay for 10% and get your insurance for the other 90%. And you're going to get $600 a week on top of that from the federal government through July 31st. So that was something that Congress passed, and it is intended to keep you going so that we are in a position to hire you back, and we hope to call you back. If you're one of the 1,300 in Category B, a lot of them are office management assistants, accountants, information technology specialists, financial analysts. We're going to ask you to actually work 4 days a week. You'll draw your 80% city pay every other Friday. You'll keep your city health insurance. You'll get state, what they call work share benefits, basically unemployment for the day that you're off. And you'll get $600 a week for your unemployment through July 31st. For some people, you may make a little bit more, before July 31st. After July 31st, you'll make less. But we want to bring you back as the economy restarts. For the executives who are making more than $125,000, you'll get an immediate 5% pay cut. We hope you'll keep coming to work, and you're going to have to give up a July 1st pay raise. And for 5,500 people in Category D, our police officers, our firefighters, our EMTs, our DDOT drivers, our mechanics, and the others who have to work public-facing shifts where we can't have you work every 2 days or 4 days out of 5. Your pay and benefits and work hours are going to stay the same. If you do have a contractual pay increase, and about half the people on this list do, we're asking that you give up that increase because that'll give us money to keep the health care going for the people who are losing their wages. So here's how it's going to work. If you are a temporary part-time Category A or B employee, here's how it's going to work. This Saturday, Denise Starr and our HR department will file your unemployment claims for you. You don't have to file anything. You've read all this stuff about how hard the system is and it crashed and all that. Governor Whitmer and Jeff Donofrio, who's running it, who used to work here, have set it up. So the city is going to do the filing for all of you. You don't have to file a thing. On Friday, April 24th, you'll get your last full city paycheck. So your work from April 6th to 19th, you'll get a full paycheck on April 24th. And then you're going to get a state debit card in the mail that looks like this. And on May 8th, you will get pay on your debit card, and it'll be every other Friday on the same schedule you had with the city. Make sure your current home address is on file with the city, because we're sending the entire file to the state of Michigan, and they're going to mail this card to your house. So whether you're on UltraPro or if you're in the police department, talk to your HR folks, but make sure the home address that's in your file, your city file, is where you want this card to go, because it will be coming. If you're a Category A worker, a 10% worker, Friday the 24th, you'll get your last city paycheck. May 8th, you're going to get a city check for 10% of your time. On May 8th, you're going to get a state debit card credit for the other 90%, some portion of it, plus $600 a week. And every other Friday, you should see both payments. You'll get a smaller city check and a bigger state check. Category B works the same way. You'll just get a bigger city check and a smaller state check. So for the city of Detroit residents, we're going to see some cuts to service. You can't cut $348 million and not have it affect you. And so you're going to see delayed road repairs. You're going to see closed recreation centers. The blight is going to get worse in the neighborhoods. We've got to find a solution to it, but that's the truth. These are painful cuts. And a lot of your city services, you're going to have to go to kiosks or go online because the offices won't be open. As the economy comes back, we will do the best we can. And let me take just a minute and tell you about what a restart will look like. And this is my idea. All kinds of people nationally have their own ideas. As far as I'm concerned, we're going to bring people back in the city based on medical advice, not based on people saying, turn the whole country back on, stay inside for the next year. But here's what I know. The Detroit Police Department probably has some guidance on this, because at DPD, we had a period there, we had 100 people a day being quarantined. Now we're down to 4 or 5 a day. And here's what we learned. We did extensive testing of our officers and the staff with the 15-minute test, so we knew who was infectious and who wasn't, and we separated them. Every day as they come into work, we take their temperature with a thermometer. If somebody's over 100 degrees, I get a text on my phone, and we send folks home or off to a doctor. They wear masks to prevent the spread of disease. We know people who don't have symptoms are inadvertently breathing infectious germs on others. We have intense cleaning protocols. Something like this is going to be the way that the job of the future is going to be. In my office every day, I go to work every day on the 11th floor of City Hall. We have a skeleton crew. All of us have been tested. We're all negative. We wear masks so we don't breathe on each other. There's cleaning every night. But I think for a period of months, this is going to be it. When we go back to work, I believe we're going to go back to work with a lot of testing and folks wearing masks until there is a vaccine developed. I think it's possible to restart this economy, but workplace is going to look a little different. And so what's the restart going to look like? Just my guess. I don't think we're going to flip a switch and everything's going back to work. I think in the early phases, you'll see things like landscaping and road and sewer repairs and construction. You could have people spaced out, working outdoors, having folks with gloves and masks and testing. You could see that being an area that could medically safely be open first. And then there'll be a middle phase before we start sitting too close together in the offices or passing a car down a line. There's going to be a higher level of care. And then the later phase, and this is just the truth, it's going to be a long time before we're going to movie theaters or sitting down at restaurants or going and sitting at a sports stadium, because that many people coming together at one point is going to take even a higher level of protection. And so the city of Detroit's going to be ready when it's medically appropriate to go through each of these phases, and we want to get back to work, but we won't get back to work in a way that jeopardizes your safety. So thank you for giving me the time this evening, and I'm going to be joined now by Denise Starr, our Human Relations Director, and Tanya Stardemeyer, our Budget Director, and we'll get a chance to take some questions. And we'll take a half a dozen or so questions tonight, and then we'll respond by email to the others. And with that, we'll ask Ray Solomon from Neighborhood Services what questions we have coming in.
Yes, Mayor. Department of General Service, Angelique Perriman. I wanted to know, is it possible for the city to float a municipal bond to subsidize portions of the deficit instead of cutting jobs?
Yeah, we can't borrow money to cover deficits. So that's what the city of Detroit did for years. The way Detroit got into bankruptcy is it took in $1 billion a year in revenue, it spent $1.1 billion, and it borrowed the difference. The State Financial Review Commission will never let us do it. We're not going to run in deficit. We can't do it. We're going to live within our means. We don't have any choice. Otherwise, the state's going to end up taking us over again.
Emily Collette, Police. What is the risk of those who have been put on furlough or put on work shared of being laid off?
So I would say the people at the 10% level, if the economy gets a lot worse, are at the most risk of being laid off. And people at the 80% level might get moved to the 10% level. I can't promise you what the future is. I've looked at these numbers. I think we can get this economy restarted. And I'm really hopeful that what I'm showing you today, that there's going to be a day that DDOT opens up their front door in the fare boxes, and I'm calling the DDOT tellers and say, come on back to work. I'm hoping there's a day there's a traffic jam on Jefferson, and I'm calling the police traffic control officers and say, come on back to work. Because when those things happen, the revenue will be coming in. So it all depends on where it's going. If the people of this city continue the social distancing that we've seen in the last 3 weeks, we will come out of this sooner rather than later, and you'll be rehired full-time sooner rather than later.
Mildred Morris, Water Department. Is it possible that the city could offer some type of severance package for employees that are close to retirement so those that have less time won't lose their jobs or be laid off?
We cannot legally, under the terms of the bankruptcy agreement, change any terms of retirement without going back to bankruptcy court and reopening that. So I won't completely rule it out, but it would be extremely difficult legally. We have a prohibition on the bankruptcy court from modifying retirement in any way.
Chelsea Cox, Police. Who is available for hazard pay? Oh, who is eligible for hazard pay?
Denise, you want to take that?
Sure. You could see the list of the job titles online on the HR website. So go to the City of Detroit website and the HR portal, and you'll be able to see the list of job titles. If your job title is not there, if it's and you want to inquire about it, then you can submit on the smart sheet your inquiry. This hazard pay are for public-facing individuals, primarily police, fire, those from the health department that are supporting our testing sites, and other public-facing positions.
So basically, if your job requires you to interface with public and a whole range of people we don't know every day, that's hazard pay. If your job requires you to be in an office seeing the same people every day, that's not hazard pay. That's a rough division, but you can go on the site and see exactly each job classification and where it falls.
Bridget Lamar, Police. Will bumping rights as outlined in HR Rule 10 apply to those that are reduced to one-day schedule?
We are following Rule 10 when it comes to the layoffs. Rule 10 covers reduction in force only. So we are not following Rule 10 for the other categories.
Right, bumping does not apply for reduced time.
Ronald Yan, DPW. How can you make cuts in some areas and give hazard pay raises in other areas?
Well, that's a hard question. And I think the police and fire and bus drivers feel like we should have paid more in hazard pay. And I know they feel that way. They've expressed that to me. We tried to find the right balance. The hazard pay is costing about $3 million a month. But I just don't know what to tell you when you see almost 200 members of the Detroit Police Department that are positive for COVID-19. And between DDOT and the fire department, probably another 70 or 80 in what they're exposed to every day. It was a judgment call I made that it takes a lot of courage to do what they've done. They've been a huge part of knocking this thing down. And so I thought $3 million a month for the people that are facing that danger every day was a reasonable thing, and others may disagree with me on that.
Donnie Chandler, Assessor's Office. Does the city qualify for any other package offered by the government to recoup some parts of the money to try to keep the city employees paid during this pandemic?
Yeah, we do. So I showed on one of the charts, I'm sure the question came in before that, we got $36 million to subsidize DDOT, and that has made things easier than it could have been. Now, Nancy Pelosi and Chuck Schumer and even Steve Mnuchin, the Treasury Secretary, has been supportive of a package that would support local government. It was all being hammered. Whether that gets passed in Washington or not, I don't know. We're lobbying for it. But I have to make the decisions today based on the information I have today. If Speaker Pelosi and Chuck Schumer and the President succeed, then and we get more money, I will be glad to ease this off. It would be a really nice day if I could come back and tell you things got better.
Kakaya Stephen, OCFO office. When we return to work, will we be allowed to wear a mask?
I think this is just my guess. I'm not a doctor. But here's what I believe will happen, and I'm spending a lot of time thinking about this. If it were my decision, and it may be in the city, before your department, what department did you say it was, Ray?
OCFO office.
OCFO. So before your department came back, I would have every single person in the department tested on the 15-minute test to make sure they were negative. Once they were negative, I'd bring them back. I would require them to do just what I'm doing today. I put the mask on if I'm going around other people. If I'm in my office by myself with the door closed, I don't need the mask. But if I'm interacting with people and breathing on people, everybody on the 11th floor in the mayor's office wears a mask. I bet we're going to be doing that 3 or 4 months from now until there is a successful vaccine, and that, I think, is going to be several months away. So I think it may be even more than you can wear a mask. We may require you, if you're sitting in proximity, to wear a mask. We would also have very strict cleaning protocols, probably a couple of times a day as well. And so before we bring you back, we will work all those things, but we're only going to bring you back in a safe environment, and I will promise you this, whatever your work environment is in the office of CFO will be exactly the same as mine in the mayor's office. It will be done properly.
Antonio Mitchell, again, Office of OCFO. When is there an expected date for us to stop working remotely?
So that goes back to the other question. And I don't know how to guess that. I'm gonna guess that you'll probably see the construction crews and the landscape crews and the road crews out sooner than you'll see the offices come back. Now, we may have some offices where people are sufficiently spaced out. We may have jobs that are so critical. If you're on an assessment cycle and you got to be able to be there, we may bring you in and space you out. But I would say it will be probably months, not weeks, before you're in the office.
Last question, Amanda Saab from CREO. And if your question was not answered, you will get an answer by email. The last question is, What will our new normal look like? What will it look like after 6 months to 1 year?
What will what look like?
What will our new normal look like in 6 months to 1 year?
So I'm guessing there's people all over the country got their own opinions. I think you're going to see in the next 2 or 3 months landscape work, construction working, a lot of the outdoor stuff going. Maybe in 4 or 5 months, you're going to see manufacturing going with people on the lines wearing gloves and masks, lots of testing. You probably will not be able to go to work without a thermometer checking you before you go in the door. And there will be some people who get tested in the so-called serology test. They'll actually stick your finger, and if your blood shows that you had the coronavirus, you got antibodies, you might be able to come in without a mask. You may be determined to be immune, but we don't know that for sure yet. That's still speculation. But 2 or 3 months down the road, I think there's going to be a group of people who have had it, who are certified as immune and safe. And you could be in a situation where you have 4 people working in the office and 3 have a mask and 1 doesn't because 1 was certified as immune. I don't think you're going to see people sitting next to each other in sit-down restaurants or movie theaters or at baseball games until there's a vaccine. And that could be several months. I mean, you could see an NFL season where the players are on the field and you're watching on TV and no stands. I think something like that is a real possibility, because if you get a large group of people together, the likelihood of disease spread gets higher. You can manage it pretty well in small settings. As I say, I don't feel at all unsafe going into the office every day. I'm more nervous going into the grocery store and picking up a box of cereal. But we're going to manage this with what the science says, a step at a time, and I will communicate with the employees every step of the way on why. And there's one other thing that might be the new normal. These are going to be terrible things to say. I just tell you the truth. If you have serious asthma or you have a heart condition, you may not come to work as soon as somebody else, because the truth is, if you get COVID-19 and you've got some of these other conditions, you have very likely a higher risk not to survive it. We could be in a situation where something like FEMLA now, where you can stay home if you have a recurring illness, there could be a version of FEMLA that emerges that said if you've got serious asthma, that you don't have to work in the office. I'm just speculating, but these are the kinds of things that we're going to have conversations on. I wish I could sit with a group of 200 or 300 employees and just talk this back and forth, but I can tell you we've got some of the best doctors in the country, Dr. Mark Zervos, Dr. Dunn, and the team, who are deep thinkers. I'm partnering with the Rockefeller Foundation, who just put $500,000 in here. They want us to be part of planning the safe return. It's run by a physician who wants to make sure the return to work in America is done medically appropriately, not politically. And at least if I have anything to say about it, nobody's coming back to work until it's medically appropriate.
Thank you, Mr. Mayor.
All right, and so for the rest of the questions, we will take them by mail, and thank you, and for the TV stations that carried us, for everybody else, thank you very much. And Tanya, sorry.